We begin with some troubling developments and potential setbacks in the nation's fight against COVID-19. For the first time in months, cases and hospitalizations are on the rise across the U.S. Health officials say that they're worried about a possible wave of infections before and after Thanksgiving. Meanwhile, a federal appeals court paused the Biden administration's vaccine mandate that requires workers at big companies to get their shots or face weekly testing. Laura Podesta reports from New York. Laura, good morning.
Good morning, Anne-Marie. Yes, the court called it unlawful overreach, but with the increasing number of cases, the concern is if people don't get vaccinated, we'll see hospitals once again being overwhelmed with patients.
Hopes are fading that the coronavirus is receding in the U.S.
It's tough because it's a lot of preventable illness.
After a 2-month decline, the nation's COVID-19 numbers are again rising, with at least 20 states reporting increased case numbers.
There are some parts of the country that still haven't had their Delta wave that unfortunately are going to be hit pretty hard.
Former FDA Commissioner Scott Gottlieb expects most unvaccinated people will eventually be infected. He says even those considered fully vaccinated are at risk.
We now see very clear evidence of declining vaccine effectiveness over time. Anyone who's eligible for a booster, and most Americans probably are eligible for a booster at this point, should be going out and seeking it.
Colorado is among the current COVID hotspots. Officials there have set aside the federal guidance on booster shots and made them available to all adults, not just those in high-risk groups.
I've been very frustrated with the convoluted messaging out of the CDC and the FDA. Everybody should get the booster after 6 months. The data is incredibly clear that it increases your personal protection level.
Experts are advising people to get vaccinated now, before the holiday season gets underway, and ahead of what they say is an inevitable post-holiday COVID surge.
And experts say a booster dose can restore the effectiveness of a coronavirus vaccine from 50% to 95% if administered at least 6 months after the initial shot or shots. Anne-Marie.
Got to get that information out, Laura. So where are the current U.S. hotspots and when it comes to cases and hospitalizations? And are officials in states seeing surges, taking any additional measures to try to bring them back down again?
They are. And, you know, it's not an exaggeration to say that there are COVID-19 hotspots from coast to coast, mostly in areas that you heard Scott Gottlieb say have not yet been hit by the Delta variant. And that includes the southwestern part of the country, as well as the Great Lakes region and parts of New England, here in New York and Pennsylvania. There are 3 states, Colorado, as I mentioned in the report, California and New Mexico. They've responded by relaxing the rules for booster shots to allow all adults eligible to get one. And that goes beyond the CDC's recommendation to limit extra doses to people in those higher risk categories. Anne-Marie.
So that actually brings me to my next question. So certain areas have taken that step, but I'm wondering about federal regulators, whether or not we will see them expand eligibility for booster shots.
A great question, and unfortunately we don't know right now. When the FDA said no to authorizing boosters for all adults, it said the available scientific data did not support that idea. But the agency said, you know, it would move quickly to review the decision if new evidence emerged. And several studies have shown that the vaccine's protection diminishes significantly over time. Pfizer, for its part, says the early results of its booster trial showed it can restore the vaccine to its original effectiveness over 90%. So many are expecting the FDA to approve Pfizer's request to offer booster shots to everyone 18 and up. It's just not clear when its decision will come.
Okay, so at this point, though, you know, anyone can get the shot if they want to. Some people need a little encouragement, but the Biden administration's vaccine mandate has been blocked. So that's not going to happen, at least for now. I'm curious about what experts are saying about the possibility of a post-Thanksgiving holiday weekend spike, because, I mean, people have not seen their loved ones in quite a long time, and you know, many people are vaccinated, so you know that people are going to be traveling.
Yeah, if you're vaccinated and you're traveling, I mean, you have put yourself into that sphere of protection. But the people that are choosing not to get the jab Public health experts say those are the kinds of folks that are going to contribute to a surge. And right now they do believe, because there's a percentage of the population that is not getting vaccinated, that a surge is inevitable. There have been significant spikes, Anne Marie, we've reported it, after nearly every major U.S. holiday since the pandemic began in 2020. And this period from Thanksgiving through New Year's is especially dangerous because not only are more people traveling during this time, they also tend to spend these holidays indoors, often sitting around a table with other people, and these gatherings create that perfect setting to spread an airborne illness like COVID-19.
Yep, lots of talking, sometimes some arguing. After all, it is Thanksgiving, but yeah, there's a lot of circulation.
There should be a new rule: no talk of politics, no talk of religion, money, or the vaccine at Thanksgiving dinner.
I love that new rule. Laura Podesta said it. Laura, great talking to you. Thank you very much.